do U.S. healthcare executives make so much money? The highest paid CEO working in American healthcare, Moderna chief Stéphane Bancel, brought home $300 million last year. His net worth is estimated at between $2 and $4 billion. Next on the list is Peter Gassner of Viva Systems, $245 million. Number 3 was Martine Rothblatt of United Therapeutics, who made $85.4 million. The 5 highest paid CEOs of the country's health insurance companies all made more than $20 million last year. And those are just the big dogs, mind you. There are countless CEOs and CFOs spread across hospitals and pharmaceutical companies all over the United States, making high 6 and low 7-figure salaries. Where does that money come from? It comes from us. The American healthcare industry profits from sickness and misfortune. When you have a procedure at a hospital, every person you interact with has their hand out, and each link in that chain must turn a profit on the transaction from the doctors and the staff to the hospital to the insurance company. Every time you get charged $15 for one Tylenol at the hospital, or your insurance company gets billed $800 for an IV bag that costs about $1, we are ultimately the ones paying those costs. More and more of that money is evaporating out of our paychecks. According to the Bureau of Labor Statistics, the cost of providing medical benefits rose 258% between 1986 and 2016. Rising healthcare costs depress wage growth. According to a survey of 300 employers, in the year 2014 alone, healthcare expenses rose 10%, while wages only went up 4%. If your company is forced to pay more for health insurance, that means fewer people get raises, a significant factor behind stagnating wages over the last few decades. And bigger chunks of our total compensation are getting channeled into insurance companies and away from us. The American for-profit healthcare system creates all sorts of perverse incentives that do nothing to improve public health. Our medical system is geared more towards high-profit, high-tech interventions than boring old prevention. A 2006 New York Times article talks about the problem diabetics face. Frequently, a $150 visit to the podiatrist to deal with foot problems caused by the disease won't be covered by insurance. But nearly all insurance companies will cover a foot amputation that costs around $30,000. The Times quotes Diana K. Berger, who points out if a hospital charges and can get reimbursed by insurance $50,000 for a bariatric surgery that just takes 40 minutes, or it can get reimbursed $20 for the same amount of time spent with a nutritionist, where do you think the priorities will be? Other countries keep their healthcare costs in line by setting limits, a floor and a ceiling. A universal healthcare system covers everybody, but it doesn't cover everything. In Japan, the government sets strict limits to control costs. They set income levels for medical providers, determine what treatments and drugs must get paid for, and negotiate the prices insurance pays out. In the US, the biggest and most influential insurer in the country is prohibited by law, the Medicare Modernization Act of 2003, from negotiating drug prices. This is one of the primary reasons Americans pay 2 to 10 times what everyone else on the planet pays for the exact same drugs made at the exact same factories. Every person in Japan can go to the doctor if they get sick or injured. Every broken leg gets treated. But not every procedure is approved. An 86-year-old with advanced heart failure will probably not be allowed to get aggressive, expensive treatments. This is the bludgeon used to defend America's healthcare system. Rationing! Death panels! Any healthcare system that agreed to pay out every claim would eventually collapse. But it's silly to pretend that the American system doesn't already have rationing. Writer David Sirota underscores this point in his book, Hostile Takeover, saying, just stop for a moment and think about it. The whole point of for-profit health insurance companies is to ration care and limit the amount of coverage its patients get in order to make money. The only difference is that here, for-profit insurance companies are the ones who decide who lives and who dies, not the government. Why would it be better to have the government making such decisions? Because private companies are completely unaccountable to the public. We have no control over a corporation's decision-making process. This is the very heart of the distinction between public and private. At least if the government were making decisions, the public would theoretically have a way to hold decision makers accountable through the democratic system. It might not be easy, but ultimately the government is accountable to us. Business is not. This is part 3 of a series about how capitalism is destroying American healthcare. In my next post, we'll take a closer look at some of the other advantages of universal healthcare. and why it seems like an impossible dream here in the US. Until then, please like, follow, favorite, repost, and sign up for my Substack so you can have my posts sent directly to your inbox. Let's make them pay.